consultant physician and head of the Respiratory and Infectious Disease University of Port Harcourt Teaching Hospital, Dantoye Alasia, joins us now. Thank you for finding time to join us on TVC News at 7. What exactly do you know about the isolation and treatment centers in Rivers State?
Well, for now, it's a 30-bed facility. And I'm sure, as you all know, we just have one index case. And yes, I mean, it's a 30-bed facility, and we have just one index case, as we all know. But we are aware that there are plans to scale up the capacity, which is what is going on across the country. So we do believe that within the next 1 week, we are going to have expansion of sites across the state, both in the current treatment center and also in the University of Port Harcourt Teaching Hospital and other areas, so that there's adequate planning for the worst case scenario, which we do not pray for.
All right, 30-bed space with just one case might seem good, but then what is a general assessment of the state government response to the outbreak so far?
Well, I think that most of it is in the public domain. We know that there's restriction of movement, which is trying to enforce social distancing. As at yet, we have just one case, so we hope that those measures will help to keep it that way. But there are many other areas which we know are also very important beyond the lockdown. So we are also looking at ensuring that they scale up the capacity for healthcare workers, training, and then getting more hands on board by recruiting volunteer staff, and also getting those who are retired, who have essential skills to join up. Some of the other things which we know are very necessary are the availability of personal protection kits. So while the government is doing its part, we also are aware that there's a lot of private sector initiative, and everybody is pulling resources to ensure that we have all that we need to contain this. The other part is drugs, and I'm sure that on that part there's a technical working group within the state, and there's also an emergency operations center that's monitoring the daily situations. And the technical working group also has its own treatment regimen and treatment protocol, and those protocols are reviewed on a daily to ensure that patients who are on admission get the best. But we also want to emphasize the need for us to ensure that we bridge the gap in testing, which is a major gap in Rivers State. So we do hope that the efforts by the NCDC and other partners to scale up the testing capacity will come to fruition within the next few days, because that's a major challenge for us in the state. And we hope that they can scale up the testing sites in the University of Port Harcourt Teaching Hospital and the Rivers State University Teaching Hospital, so that we can bring testing closer to the people.
All right, consultant physician and head of the Respiratory and Infectious Disease University of Port Harcourt Teaching Hospital, Dantoye Alasia, thank you for joining us on TVC News at 7.